Welcome to ABM University's virtual classroom. I am Dr. Angel Real, your instructor for today's lesson. Let's get started. What contributes to about 65% of the body's weight? Carbohydrates, fats, proteins, vitamins, or water? If you answered water, you are correct. Water contributes to about 65% of the body's total weight. How should the medical assistant protect the patient from injury during a seizure? Give the patient small sips of water when the seizure is over. Instruct the patient to put on a helmet. Lower the patient to the floor and go find help. Make sure the patient's face is turned to the side, or position the patient on his or her back. The correct answer is make sure the patient's face is turned to the side. When obtaining a blood pressure reading for a patient, the medical assistant notes the diastolic measurement upon observing which of the following: hearing a gap in sound as the air is slowly released, hearing the first sounds after pumping up the cuff, hearing the last sounds heard as air is slowly released, hearing the loudest sound, seeing the highest reading after the cuff is pumped. The correct answer is hearing the last sounds heard as the air is slowly released. What is the volume of air that can be exhaled during forced breathing beyond the resting tidal volume? Residual volume, expiratory reserve volume, functional residual capacity, vital capacity, or total lung capacity? The correct answer is expiratory reserve volume. When taking blood pressure, which piece of equipment is used for auscultation? Glucometer, ophthalmoscope, otoscope, sphygmometer, or stethoscope? The correct answer is stethoscope. What controls the permeability of the distal tubule and collecting duct in the kidneys? Angiotensin, aldosterone, atrial natriuretic factor, sodium ions, antidiuretic hormone. The correct answer is the antidiuretic hormone. Which is the most commonly used equipment for collecting venipuncture samples? Capillary tubes, collection syringes, evacuated tubes, lancets, or micropipettes? The correct answer is evacuated tubes. In a cardiac stress test, which of the following is measured in addition to heart rate and rhythm? Blood pressure, miles walked, respiration rate, speed or pace, or temperature? The correct answer is blood pressure. Which device is used to create a controlled environment for growing microorganisms? Autoclave, centrifuge, incubator, inoculation loop, or microscope? The correct answer is incubator. A urinalysis demonstrates the presence of red blood cells, white blood cells, and nitrates in a urine sample. A culture is recommended for further evaluation of potential urinary tract infection. Which of the following might the medical assistant note on physical examination of the urine to be cultured? Glycosuria, hematuria, oliguria, proteinuria, or turbidity? The correct answer is turbidity. Which of the following statements could be listed as the patient's chief complaint? I am experiencing severe back pain. The respiratory rate is 26 breaths per minute. The blood pressure is 140/90. The x-ray shows a minor fracture. Or the patient's temperature is 100.4. The correct answer is I am experiencing severe back pain. A 57-year-old male patient is prescribed an analgesic patch for pain control. Which is the route of administration for this medication? Instillation, intradermal, subcutaneous, sublingual, or transdermal? The correct answer is transdermal. Which of the following is objective data? Fatigue, itchy skin, nausea, pain level, or reddened sacrum? The correct answer is reddened sacrum. Which hematological value, if found to be elevated, would suggest inflammation somewhere in the body? Hematocrit, hemoglobin, iron R, red blood cell count, or sedimentation rate? The correct answer is sedimentation rate. Which physical examination technique uses a tape measure or ruler? Auscultation, inspection, mensuration, palpation, or percussion? The correct answer is mensuration. What is an example of behavior modification practice for weight loss? Always clean your plate when you eat, controlling the stimuli associated with overeating, feeling guilty after you overeat, providing punishment for unsuccessful behavior, or skipping meals. The correct answer is controlling the stimuli associated with overeating. Which hematological value assesses the number of thrombocytes in a blood sample? Hematocrit, hemoglobin, international normalized ratio, platelet count, or white blood cell count? The correct answer is platelet count. Which physical examination maneuver is performed at each infant well visit to assess for hydrocephalus? Head circumference, head inspection, head manipulation, head palpation, or head percussion? The correct answer is head circumference. Which condition has the symptoms of acute dyspnea, wheezing, and cough and is treated with bronchodilators? Asthma, hyperventilation, myocardial infarction, syncope, or vertigo? The correct answer is asthma. A medical assistant is measuring a patient's oxygenation with a pulse oximeter. Which of the following is an appropriate step to maintain accurate monitoring? Apply blood pressure cuff above the pulsometer site. Ask the patient not to touch the oximeter. Tape the pulse oximeter to the patient's finger, or test the oximeter on another patient. The correct answer is ask the patient not to move the oximeter. Which of the following subtypes of urine collection refers to a single void that is performed at any time of the day and without added special instructions? 24-hour urine specimen, clean catch urine specimen, first morning specimen, random specimen, or timed urine specimen? The correct answer is random specimen. Which medical emergency is associated with the symptoms of hot, dry skin, an altered mental state, weakness, rapid breathing, and a rapid pulse? Hyperthermia, hyperventilation, myocardial infarction, syncope, or vertigo? The correct answer is hyperthermia. Which of the following questions would help determine a patient's social and occupational history? How long have you had the pain? How are you managing the symptoms? How many cigarettes do you smoke per day? Do you have any history of cardiac disease? Or is there any swelling? The correct answer is how many cigarettes do you smoke per day? Which is most important for the medical assistant to remember when working as a sterile scrub assistant? adjust the lighting for the physician as needed for visualization, dispose of used items during the procedure, label the specimen with the patient's name and identification number, monitor equipment for problems, only touch sterile items with sterile gloves. The correct answer is only touch sterile items with sterile gloves. A patient exhibits erratic behavior, slurred speech, and track marks on both arms. Which of the following should the medical assistant suspect from this observation? Alcohol abuse, domestic violence, drug abuse, eating disorder, or uncontrolled diabetes mellitus? The correct answer is drug abuse. How many leads does a traditional Holter cardiac monitor have? 1 lead, 2 leads, 3 leads, 5 leads, 7 leads, or 12 leads? The correct answer is 5 leads. Which medical condition is associated with sensations of the room spinning and feeling off balance? Asthma, hyperventilation, myocardial infarction, syncope, or vertigo? The correct answer is vertigo.